Hello, and welcome back to the IVF Daddies podcast. I mean, we have done 3 podcasts with the same sweater on different days. We're filming this podcast one after the other because we have so many topics. Sometimes it's really hard to create a podcast. Sometimes it's really hard to come up with topics. No, I mean, we travel a lot, but sometimes it could get redundant and we can go back in circles. And sometimes it's like so hard to create a podcast, as you saw in the clips before. And then sometimes it's like, well, this is happening in our faces. This is happening in our faces. The other thing that is happening in our faces is, and I'm going to challenge you on, this. Is me trying to pronounce something good. I'm going to challenge you on this. I have a friend that got an injection of Ozempic, and she's never been on, what do you call the pill that you don't want to get pregnant?
Contraceptive.
She's not been in contraceptive. She's not been IUI. They have done the pull method.
IUI is when you're trying to get pregnant.
Oh.
An IUD.
DUI.
No, that's when you're drunk. An IUD.
What?
DUI, drunk driving under the influence. DUI.
If you reverse it,
intrauterine device.
Whatever. She was none of those robots, and she was in the pull-out method. Very religious, and she tried Ozempic for this summer, and then she was like, ooh, this Ozempic symptoms I don't really like, and then she stopped Ozempic, and then she was like, ooh, I don't know, is it normal for you to keep having these symptoms? And then, boom, she's pregnant. So babies on Ozempic and the rising. Is it true or is it not true?
Well, what is true is the pull-out method doesn't work.
It worked for years until Ozempic got in. Didn't pull out the Ozempic.
Anyway, but we do, we've spoken to doctors about what Ozempic does apart from...
Roll the tape.
I mean, everything is about, in our bodies is moderation, right? So if anything is, there's too much, there's too many cytokines, which is something with inflammation. There's too many antibodies, which is with autoimmune, right? There's too much stress, which is too much cortisol, right? Anything that can bring those things down and sort of give you a better environment in your uterus, a better environment around your eggs, a better environment around the baby that's growing is definitely going to be beneficial. It's just sort of hard to quantify how Ozempic specifically does it, right?
But we are seeing that it's working.
Definitely seeing that it's working, yeah.
Which is
pregnancy rates are going up.
Yeah, reducing your fat. It reduces inflammation. And therefore, one of the side effects of inflammation is your body feels better, does better, and there has been a rise in Ozempic babies. Women that are getting pregnant partly because of Ozempic, yeah. And they're thinner, and maybe that's had something to do with it.
Yeah, so then that brings to the topic that we also reach out to a nutritionist that we will have soon. So in the meantime, we're going to create controversy so we can just clarify. And please just let us know how lunatic we are. Because I remember there was a friend of mine 10 years ago, we were going to get her eggs frozen. And I remember she was like researching, we're going to have to go eat sea urchin. And if you eat sea urchin raw, it's good for your eggs. If you eat this, it's good for your eggs. If you have like fasting and celery juice, it's good for your eggs. And apparently, vegan reduces inflammation, but it doesn't. It's like your uterus doesn't care if it's almond milk or oat milk or dairy milk. So, like, what part of food is? We know that sugar is not good for you. We know that inflammation is not good for you. But if I go on a Gwyneth Paltrow bone broth for a whole month to get my embryos in or eggs frozen, am I getting the right nutrients? If I get my nutrients in pills, do they do the same benefit as if I eat them?
I would assume that if you think about it, anything that's going to be good for you is going to be good for your eggs or sperm. So antioxidants, vitamins, B12, like all those different things. So if just logically, if you think, fasting, intermittent fasting, a lot of people do it, that can be good for you, but it also creates on a molecular level stress.
You fast every 2 minutes.
I fast every time I'm asleep.
Your intermittent
I
fasting
need to
is every
fast.
2
It's
minutes.
coming up to summer. I need to lose some weight. Sorry, I'm getting fat.
He's not getting fat, but he fasts every 2 minutes. He gets really hangry.
I get really hangry. I don't know why. That's sugar, I guess.
Yeah, sugar gives you a headache. And okay, so then there's things that we know for sure they're better for the ecosystem of your uterus and your egg machine and your embryos and creating a baby. And there are other things that are BS. They're not like, you don't have to go to those extent to go have.
I think anything in the extreme is bad for you.
Yeah, but some people think it's like organic, but then you have all like organic means like they put more pesticides. They're by the law allowed you to call them organic.
But I think the whole definition of organic is no pesticide.
Not, but then you can put a lot more of the natural ones that are more
like ladybird.
Things like that, and then they put like shitload, and then it's not good for you.
You don't eat the ladybirds. They eat the bugs.
No. But like the organic is not like.
But it's like organic honey. How can organic honey be a thing? Because you don't know where the bees are going.
Yeah, is the flowers have pesticide in it.
Right, but that's my point. So how can it be organic honey?
Well, if you have a controlled farm and all that area is, if you have a winter house, can you have bees in a winter house?
No, because they want to fly.
Winter house.
I miss my beehive. I used to have a beehive.
I don't know what's going on with him today, but it's just ADD.
I had a headache and he gave me a pill and he said it was ibuprofen. I'm not entirely sure.
I did not drug you.
Anyway, so I think there are myths around food, and it would be great again. There's friends of ours that are nutritionists that could come on. But I do think food plays a very big role. And hydration, like I never drink enough water during the day, which is why I've got my water bottle now and I'm drinking. But it's like I never drink. And I think, on a cellular level, again, as I was saying, fasting stresses you on a molecular level. Dehydration stresses you on a molecular level. So I think
digesting food stresses you on a molecular level. Your body's working, your blood is up in your stomach. Everything.
But then it takes those nutrients and the good things. So if you're eating potato chips or candies, that's going to be different than if you're eating pineapples or bananas. No?
I mean, as long as, to me, if he has graphic design, it comes from evil people.
Yeah, you say that a lot.
I like to eat food as it comes from nature.
Clean. I could never run a farm.
It's the same as in the patisserie. In Patisserie Margot, we avoid seed oils like sunflower seed oil and preservatives, antibiotic, anything. We just work with the best raw ingredients from the garden to the kitchen, and the best. You literally cannot put a cake in the fridge for 3 days because
it goes off.
It goes.
But I think again, those are all different things. But that's how they found penicillin. Penicillin was on bread, wasn't it?
Yeah, they wanted the fungus of the bread. It wasn't a steak.
Food, coming back to food. But, for example, I don't eat fish because I don't like the taste. You don't eat shellfish because you're allergic. Does that have impact on our bodies and our sperm?
Well, I do know that if women eat certain things when they're breastfeeding, the baby will not stop crying, like chocolate or seafood or...
Did you know that HIV can pass through breast milk to a baby?
No, I mean you have to be more specific. If your viral load is not undetectable.
So I used to work a lot with a charity called Mothers to Mothers, which is based in Africa, and a lot of them were in South Africa. And what happens was when a woman is pregnant in South Africa, when they find out they're pregnant, they go to hospital, they have a blood test to see if they're HIV. That is one of the first things that happens. And a lot of women don't know that they do have HIV and they've contracted it through their partners. So what then happens is they have mentor mothers who then train them because they've just been diagnosed, they're pregnant, and they start taking their antiretrovirals through the pregnancy. So the child does not get HIV. Child is born and they have to stay on the antiretrovirals, their medication, because if they come off it and their viral load goes up, it can go through the breast milk to the baby.
What is the name of the person that you give the baby to feed off of their tit when they're not?
A wet nurse.
A wet nurse. That sounds like a
That used to happen
movie.
in the olden days, right?
Sounds like a porn movie.
Really?
A wet nurse.
But that's what they're called. They're called wet nurses.
What can it be like a milk, like a
milk. Well, because that's the person that goes and gets the milk out of the cow.
What can it call it, like a breastfeeding nurse?
Well, that would be a better way.
A wet nurse. Hey, wet, well done.
God.
White t-shirt contest.
Okay.
A wet nurse, really?
Do you know, sometimes I wonder if anyone listening to this just goes, these guys are nuts.
Oh, I mean, I just hope nobody's listening.
I wonder if nuts are good for you. They should be, right?
Nuts
They're
are
filled. Not those
really good
nuts.
for you.
Not those nuts. Like cashew and peanut.
Yeah, cashew. Yeah, they're good for you. Cashew's good for you.
Cashews.
I like cashew milk. I used to make my own cashew milk. And okay, so
But what were you saying the other day? You said something about almond milk, that it's got...
it takes the same amount, like it's as bad as the environment as cow milk. The amount of water it takes for you to produce almonds to consume almond milk is so harmful for the environment.
I like it.
But I mean, global warming, climate change, as long as it's not super cold in London.
Yeah. Anyway, I do think that, coming back to the topic, that food and nutrition is a very important part of anybody who's going through infertility or trying to get pregnant. Again, I'm not a nutritionist, but I would assume everything in moderation. Anything that's going to harm you, don't do it. Anything that's going to give you, do it. So antioxidants, healthy foods, clean eating, no alcohol, no drugs, no anything like that.
Yeah, but this is the thing. This is the thing about IVF and surrogacy. When you do IVF and surrogacy, you have to go through psychological tests. You have to go to like sperm cleaning, sperm washing, diet. You have to go through evaluation. You have to go to injections, hormones. And some people go to a club, have sex in a bathroom stall, and get pregnant while they're drinking and doing drugs. So
tell Boris Becker that. He did that in London in a restaurant.
Which baby do you think is going to be more healthy?
And which baby potentially is going to be more loved? That went through that whole process to get to it, so that you are doing everything you possibly can to get to a baby, or the one that ends up being there unwanted? Yeah. But that's a whole different topic.
Well, no, it talks about nutrition, because if you're drinking and doing drugs and then you met somebody and you had sex in a bathroom stall and then you got pregnant and then you just give the stress because you didn't know if you want to be pregnant or not, and then the converse, all of that with IVF and surrogacy is the complete opposite. It's like you have to be like A++ to the T to have a baby. So if anything, I mean, yeah, you can joke about like, you couldn't even swim to the egg. They have to put you with a tweezer. But the sperm and the egg are like in the best optimal conditions they could ever be, and the surrogate.
You're stacking every single card in your favor, which, remember, so I think it's a very different starting point where if you're gay or straight, right? If you're gay, then you're like, let's have a baby. I remember
Why
that.
are you reframing it as this? There's only two ways of being.
No, but I'm just two examples. There are more ways of being, and you know that. But I'm just using these two examples for the listeners. But if you are a heterosexual couple and you've been trying to get pregnant, there's trauma. There is, you have a dream, it hasn't come true. You have to deal with that.
Was it a wet dream?
No. Well, maybe it was. That's why they didn't get pregnant. I don't know. But again, there's the white picket fence, 2.4 children. Like again, that societal, you're marrying a prince and having a family. That's what people think.
What is it, 2.4 children?
It's just what they used to say the average was.
What is 2.4?
It's just what the average of family size used to be. Obviously, you don't have 0.4 for children. It was just an average number. Most people in the olden days had 2 or 3 children.
What is it, 0.4? Like an arm?
Average. No, it's not an arm. Yeah, they had 2 children and an arm.
Like in a house, you have like 2 bathroom and 1 half bathroom. 2.4 wet nurse. What the? Like, can we get modern?
We are. That's the whole point. That's why birth rates are falling. Go to Japan. The birth rate is like 0. They're not having babies. Look around the world. Fertility rates are declining. Birth rates are declining. Why? Because maybe people are waiting later.
Because they're not on Ozempic.
People don't want to have babies.
Because they're not on
Ozempic.
Stop over talking on me. Because they're not on GLP-1. Maybe go on GLP-1 and you'll get pregnant. Maybe that could be their slogan. Ozempic, just for your baby.
We have digressed massively. But anyway.
What else do you have on your notes? Throw something at me. Well, I think we started talking about it on the Crohn's disease podcast when they wanted to try food as medicine, because food is thy medicine, as Rocco says. And so if they try to be in remission through food, I mean, we all know a lot more people die from obesity than from starvation. So food has to have an impact.
Do they die from obesity or do they die from complications caused by the obesity?
You say potato, I say vodka. It's the same thing.
One is just nicer. Actually, I really like potatoes.
It's just like if you're obese and the obesity have a blood clot that only come out of obesity, I think that's like...
Yeah, I understand. I was just saying, you don't die from obesity unless you suffocate because you're...
Well, it's like you don't die from COVID. You don't die from HIV.
You die from complications arising from 100%. That's what I was saying. Yeah. But I do think there's an obesity epidemic. Obesity. Do that again? No, don't do that again. That's gross. There is an epidemic of obesity, but I wonder if things like Ozempic is going to help.
No, but let's make it personal because it sounded like we are very conscious about it. You sometimes react very strongly when I explain to kids the impact the food that they are eating has on them. Why? When I tell the kids that Pringles are not potatoes and you cannot call it potato chips because they're not even made out of anything nowhere near a potato. It's a paste that is just chemically produced and it has the same effect on your brain as cocaine. And the milk comes out of raping cows, stripping the baby out of the cow, hooking the cow to a machine, sucking all the milk till it's dry, raping her again, getting the baby out of the cow, hooking it to a machine, and then you don't like it when I say that to the kids.
I don't think telling a child that cows are raped is a really good way to educate them on where milk comes from. I just don't think that's a great way to tell a 9-year-old what they're drinking.
Okay, I'll give you that.
Thank
but
you.
Then why give them Pringles?
Why give them anything?
No, I understand to not reveal harsh truth, but then why not avoid?
But again, I think if you deny a child something, they're going to want that. So again, everything in moderation. They don't eat badly every single day.
I'm not saying
No,
that.
but that's my point. It's like all of a sudden, like for example, my kids like want McDonald's. I'm like, sure, let's go to McDonald's.
Yeah, but your
But
kids
they
don't
don't-
eat Coca-Cola.
Exactly. That's my point.
So you have strict boundaries on denying something every day.
I don't deny it.
Coca-Cola, you do.
They don't ask for it.
Because you educated him that is not good for them. Therefore, they don't ask for it. If we do that with everything else, they will understand.
But if-
maybe that's the beginning of everything. Because the reason why nutrition doctors get a lot of money and diet fasting does not sell is because people don't go to nutritionists to eat healthier. Tell me how to eat what I want to eat. Just change the hours so I can feel better about it. And they will tell you, eat the bread in the morning, eat the Pringles in the morning. Because if you tell them, this is wrong, this is wrong, this is wrong, they're going to say, bye, I'm going to another doctor that will tell me that this is right, just eat it in this hour.
Isn't this why we don't cure disease? We just make cures for the symptoms of the disease.
No, we don't do any of that.
No,
The
but we
government-
as society.
The FDA and the medical industry, they want to treat patients. They don't want to cure them.
Correct. That's what I was saying. You know it's bad for you eating a packet of crisps, but you still do it because they taste good.
But then the habit makes human or something like that. The habit, if there's pizza and Doritos and chocolate like every day in your house, even if you know it's bad for you, the temptation is there.
Which is why we have fruit. And yeah, if they want them, they're there. I don't actually have Doritos in my house. I don't have a lot of that in my house. But if they want it, okay, we'll go get it. But my point is, I don't want to be the person that denies the children stuff because I feel that if I deny it, they're going to want it more and then they're going to do whatever they can to
But
get
one
it.
thing is denying it, and one thing is I'll explain you why I don't think it's fair to consume it. And then you can do whatever you want with it.
Right.
No, but that's when I explain how milk comes from.
But-
Because it's not like I go to them and I say, hey, stop for a second what you're doing. I want to educate you on milk. I'm like, they ask me, like, do you want milk? No, I prefer almond milk. I'm like, why? Well, because of this and this and that. And then you just...
Because I love how you've reframed exactly how that situation arose. Yeah. No, it doesn't happen like that.
Nice to see you guys. Welcome.
I'll go and have myself
Ne-
some crisps because, frankly, just to annoy him, I'm going to eat a whole packet right now in front of you. Actually, do you know what really annoys me? Is people who eat crisps with their mouth open and crunchy. I'm like, no, that is just
Okay,
wrong.
so
Actually, anybody who eats with their mouth
you
open.
can say that eating with your mouth open annoys you, but you eating straight out of the bag when you're watching TV and all you hear is the bag.
I don't do that. I pour them into a bowl because you complain. That is respect for the fact you don't like the sound. Still going to eat them.
Who wants to see a movie?
It's like people who chew gum with their mouth open. Why?
Why are you even chewing gum?
Why are you
It's
chewing gum? It's
plastic.
disgusting.
Okay, now we're...
Yeah.
So we're going to cut that part out and we love you guys.
Bye.